Hi, everyone. I just want to thank you for having me here to present and the Ehlers-Danlos Society for hosting this really great conference. I'm going to be talking to you about treatment, pain, and integrated approach. I just wanted to give a little bit of background about me. I got my PhD a year ago in biomedical sciences in the Norris lab at MUSC, and I'm still here as a postdoctoral scholar studying genetic and molecular mechanisms of EDS and related comorbidities. I do want to emphasize that I'm not a physician, so although I am going to be talking a little bit about treatment approaches and things like that, none of this is medical advice. I am a researcher and basic scientist at heart. So you're probably getting a lot of information about EDS today. I just wanted to emphasize that the Ehlers-Danlos syndromes and hypermobility spectrum disorders can really have this variety of manifestations and comorbidities that contribute to both acute and chronic pain. And this can be really challenging for physicians, not only to diagnose, but also to effectively manage. Pain can really affect anywhere between 11 and 40% of the general population based on what study you look at. But it can be up to as many as 90% of people with symptomatic joint hypermobility. It might even be more than that. When I say symptomatic joint hypermobility, I'm really just referring to that sort of grouping within both EDS and HSD that I showed here. Unfortunately, a lot of healthcare professionals don't consider hypermobility to be a factor that contributes to pain. So they might notice that you're hypermobile, but they don't think about how that can be associated with chronic pain and frequent injury. But even more than that, pain can go far beyond just the joints to include comorbidities of EDS. So this is a figure from a paper that I recently got to be a part of with Dr. Linda Bluestein, Dr. Norris, and Victoria Daler, who also works in the lab. And we really talked about the way that pain can present in these conditions. And so this is one example of what someone with a hypermobility spectrum disorder or EDS might present with. So I wanted to throw in something that we're actually working on in the lab, which is a survey. This is a comprehensive survey that includes basically everything associated with EDS. It's for people with EDS or an HSD diagnosis. We want to know about comorbidities. We want to know about specific ways that this affects you, maybe medications you've taken or tried, hurdles that you've faced accessing care. Anyone, anywhere in the world can participate in this as long as they're over the age of 18. And we have a goal of 10,000 people completing the survey. When we're talking about pain and treating it, it's really not as simple as it seems. So everyone would love treatment to look like this, right? You have one pill that you take every day and you feel much better. And the reality is it looks a lot more like this. It's a combination of different things that can help you have a better quality of life and feel like you can participate in things you want to do, spend time with family and friends, have the ability to work. Even the goals of what a treatment approach can give you look different for everyone. So what can treatment look like? And again, I'm not an MD, but I did work on a paper with Dr. Bluestein, Victoria, and Dr. Norris that I mentioned. This is another figure from that paper. And Dr. Bluestein has this approach. It's called MEMS PMMS. And I'm not going to go in depth into that because it is really something that she developed and has been doing for years. But I'm going to touch on some of these letters and how they can be incorporated into a treatment plan. So one of them is physical activity, really focused on movement and exercise. I think that sometimes the idea of exercise can be a little scary, especially for people who maybe have had a bad experience in athletics or associate exercise with a lot of pain. So for some people, that may look like participating in weightlifting or playing sports and maybe more intense athletics. But for others, it might mean at the very basic level, occupational and physical therapy, or working with like a specialized PT, so pelvic floor therapy or neurophysical therapy. And then there are some really great tailored exercise programs designed for hypermobility. Sometimes these include different sort of physical therapy approaches or Pilates, different types of strength-based approaches to help people feel better. And some of these people also work a lot with managing the symptoms of dysautonomia or POTS. So I mentioned a few here that I know very well that I've seen online that have programs that you can really access from almost anywhere in the world. They all have different approaches, but all of these people that I mentioned here are really great at working with hypermobile clients. That's not to say that there aren't others out there, but finding someone that you feel like their program is a good fit for you can be really helpful, especially for people who maybe don't live near a physical therapist that understands hypermobility. There are lots of resources online for patients. There's tons of things on social media. There's, of course, the EDS Society and other organizations that provide educational resources. But I really encourage patients to be educated on their condition. That way you can also use your knowledge to find the best doctors, or maybe know when a provider is saying something that isn't a good idea for EDS because you have that background in your condition. Sleep is a really big one. That's another thing that we definitely ask about a lot in our survey. How is the sleep that you're getting? Do you have any sleep disorders? Have you even been tested for any sleep disorders? If you're in a lot of pain and you're not getting adequate sleep, it's really hard to get out of those pain cycles. So it's super important that any suspicion of a sleep disorder is evaluated and treated when there is one that's suspected. And then there's psychosocial approaches. So there's a lot of things that happen in this community. I don't think I need to explain to a lot of people here that navigating a complex chronic illness that can take a long time to diagnose is associated with a lot of trauma, medical gaslighting, neglect, anxiety, depression, and not to mention a lot of patients are neurodivergent. All of these things play a factor into your outcomes, even if they don't seem to be directly related to pain. And I'm definitely not saying that your pain is in your head or that you have pain because you're depressed, but addressing these issues can help you to feel better. And then, of course, medications. Like I said, there's obviously not a magic pill, but there are a lot of pain medications out there. Some patients have really good results with some, while others might have a terrible experience on the same drug. So there's, of course, different opioid medications. Low-dose naltrexone is one that a lot of patients say that they see a big improvement with. Depending where you live, ketamine and medicinal marijuana might be a good option for you. Gabapentin, pregabalin, and then there's SSRIs, SNRIs, tricyclic antidepressants. All of these drugs that maybe weren't necessarily designed to manage pain, but can be effective for chronic pain, could be worth considering. The real goal is to find what works for you, and that's going to be different from probably every other patient, and using that to improve your quality of life. The other question I wanted to address is one that I am frequently asked, which is, how do I find a doctor who understands EDS? How do I find someone who will address my pain? Do you know a doctor that lives in this specific city that can help me? Usually I don't. And that doesn't mean that there isn't someone there who can help you. I think the big question we have to come back to is really, what is an EDS specialist? What does that mean? There's no, residency or fellowship programs focused on EDS. There are doctors in their own siloed specialties of medicine that can address specific issues associated with it. But there really aren't people whose entire focus and training is just on EDS as a whole. So the best way to do that is really find a compassionate doctor. I think finding someone who listens, who understands, who wants to help you, and who's willing to learn more with you and educate you in that process. I think when it comes to clinical care, we still need a lot more education of all healthcare providers in every specialty, education of medical students, education of physicians, residents, fellows, all of that. We also need a lot more awareness. I know that the society is doing great things for awareness. And I will say, I think more people are talking about EDS now than ever before. So as a patient, what can you do to help? I think participating in research studies and surveys is huge. I share all sorts of studies and surveys, not necessarily ones that I'm working on, but for colleagues as well. Getting people involved and participating really helps us move research forward. And then just talking about EDS, I have found that I tend to have conversations with people and realize that they're like, oh yeah, like I have a friend who has that, or I think my sister's friend has that, or something like that. There's a lot more connections to EDS than you realize, and talking about it with healthcare providers, talking about it with your coworkers, with your friends, with your family can really help increase awareness. Being a patient and being a researcher had to be very separate things. And these were two separate roles that I was a part of. And I realized that when I kind of blurred the boundary between those, it made me a better scientist. And it also made me a better patient because I was able to take what I was learning as a researcher and incorporate that into the care that I was receiving. It's really easy to get discouraged about doing research when there's not a lot that we know to base studies on, but we need to start somewhere. So anyone who's interested in starting in the space, I really encourage you to not be afraid to jump into it. My social media is Court Science on all platforms. If anyone wants to connect, I do share studies all the time. I definitely talk about pain a lot. And like I said, you can email me and check out the lab website as well. I want to thank everyone for listening. I want to encourage everyone to not feel discouraged when dealing with pain. It's really easy to assume that the pain phase or the amount of pain that you're in is forever, and there's never going to be a day where things improve. And I can definitely say that I've been at that place, and I'm also doing much better today. So thank you so much for listening. Thank you to the EDS Society, the Norris Lab, my mentor, Dr. Norris, the other members of the Norris Lab, and Victoria Daler and Dr. Bluestein as well for working on those publications on pain.